Yes, NMT, Nightingales Medical Trust. It is synonymous with concern for elders. Let,
Right.
let it be their care, safety, shelter, legal aspects, post-retirement jobs, or say enrichment. All these things have been the concern of NMT, and each sector has a project of its own. And to know more about it, and people should be informed, we felt that the people should be informed about all these projects, how they took off, and then how they are prospering. For that, we thought of having the oral history recorded. And today, a dedicated volunteer, Kala Sundar, and me, that is a long-time member, we both have decided to have an interview with the trustees. We very much wanted Dr. Radha also to be here, but she seems to be engaged otherwise. Uh, Dr. Radhamurthy is an expert doctor, and more than that, a great human being. Thinking about the elders, this itself proves about her. And then our our own Mr. Raja, Premkumar Raja, he is, but then we call him only Raja. Now he is an able administrator, looking after all the projects and then balancing all these things. So today we are actually focusing on only Nightingales Elders Enrichment Centre. We began, most of us were associated with it even before it got a name. Even before the naming ceremony, we were all there as a part of it. Now, with this focus, we start this interview. A warm welcome to Dr. Radhamurthy and Mr. Premkumar Raja to participate in the interview and then to give us all information, the necessary information about this NEEC. Now, my first question will be, you were very much into the home care, that is taking care of the elders at home. That itself was a new project those days, that is say 22, 23 years back. It was quite a new one, something which nobody had thought of. And then later, you started this very unique project, NEEC. Those days it didn't have a name. Later, after an year or two, I think we got this name. Then how do you actually think about having an enrichment center? And what did you want actually the enrichment center to do? How did you think that it would be helpful for the elders? Any idea about it? And then please enlighten us on this.
Thank you, Madam. Good. I think it's a very interesting question. And as you rightly said, before starting NEC, Nightingales Elders Enrichment Center, we were running home health services for senior citizens. In fact, it was started in 1996 to render all possible medical help at the doorstep of the elderly. So prior to that, to tell you briefly, Dr. Radha and myself, we were working in a hospital. At the time only, we identified this gap in healthcare system. Elders were not able to avail medical services as they were mostly living alone and they didn't have anyone to take them to hospital or even diagnostic center. So that need we identified, that made us start or fill the gap in the healthcare system. That's how Nightingale Home Health Services was started in 96 to render only medical services at the doorstep. When we were rendering this medical care, maybe a team of doctors, nurses, and paramedical staff going and helping elders, who mostly live alone and who require, regular medical checkup or any other curative treatment or could be even emergency care. we were quite busy with that. At the time when we are delivering this service, we could identify certain problems of senior citizens, because when we are going home, the time elders were more open. Generally, you can't expect them to talk. But when you go home, the trust factor was more, and they could confide and tell us how. Of course, looking at them, you can't make it out. They were looking uh, quite all right, and affluent families or upper middle class and all those things. But sadly, like most of them were, leading sort of a lonely life. The loneliness was the major thing that we could see when we were rendering this home care. Sometimes, because our services were charged, and if they want a doctor to visit, they had to pay our nurse to come. Quite a few times we observed they used to call our medical team just to talk to them. Clinically, they would be all right because they didn't have anybody like at home to talk to them. So they wanted somebody to come and talk to them or give them some sort of reassurance. So we could maybe understand the problem in a deeper way, how loneliness affecting them. Because of that, they're getting into depression and the esteem level going down and living with fear, all those things. And we are social entrepreneurs. We used to always sit and discuss, it was bothering us in the sense how a country with more than 1 billion population, and here elders calling, maybe someone, medical people, just to talk to them and paying for it. And it was quite strange for us. And well, we could see other problems also, abuse and emotional issues and many other problems. Then we felt we should not confide ourselves only with the rendering medical care. Yes, no doubt, health is the major concern of senior citizens. But at the same time, when you want to really help senior citizens, you should approach be holistic. So a person can be healthy, elder can be healthy only when the person is emotionally happy, or socially connected, or not, financially secure. So we felt all these things are quite related. So we should not just focus only on healthcare aspect. So we felt the need to start a trust. Without through our enterprise, the home care, it may not be possible for us to address all those things. So we spoke to some of our friends, and we felt the need to start this non-profit organization. So that's how 98 Nightingales Medical Trust was started. And before that, we were also since we want to do something more for senior citizens, we visited a lot of old age homes in Bangalore. I think I don't remember the number, but definitely more than 20, 25 old age homes. We visited and interacted with those who are running old age homes as well as the residents over there. And to our surprise, most of the old age homes, the residents or elders were not happy. Yes, maybe accommodation, shelter is there, or they provided the food, clothing is there. But most of them, I think, they were not happy. They were not happy because, they were separated from their families, and but due to various circumstances, they had to come out, and the quality of life also in old age homes not good, and they were not happy. So when we were, establishing the trust, we felt, our principle, our founding, our belief was, we should not again get into old age home, because we were somehow convinced after interacting with elders in old age homes in India, old age home cannot be the right or preferred choice for many senior citizens. So we felt we need some need-based or maybe some family-based support systems. And that's how we thought we should work, because we were studying at the time. Because when we spoke to elders, what made them get into old age homes, we were studying all those problems, when children's inability to take care of them, or it could be physical reasons or medical reasons, it could be all those things. We thought, so if we do maybe anything through the trust, we should try to fix these problems so that we can minimize. It's not that you can't stop, because definitely we need old age homes, no doubt about it. At the same time, those who want to be part of the families, we should develop some support systems. This is where, sort of a Nightingales Elders Enrichment Centre concept came. sorry, there's a
volume.
call came. Yeah, no, it was a call came, and in 19 before starting, we wanted to mitigate the loneliness, because we wanted like that problem we should address with the first project. So we were because always like as social entrepreneurs, we discuss with people. Some of our members of home care, because mainly we used to discuss with senior citizens, because they are the beneficiaries and important stakeholders. So we were interacting with them. What were they looking for, to come out of this issue. Then after talking to them, we were quite convinced about it. At the time in a country, we didn't have any daycare center model, but there was one in Delhi. There was one in Delhi, I think in 99 only I heard about it. So I personally went to Delhi, somewhere, I don't remember the name now, and visited the place. But nobody was there. It was actually sort of a garage in a house. The board was outside. It was a daycare center for senior citizens. They kept a TV over there and a few chairs and newspaper. Then I was talking to the person who was running it, and the idea was good. But maybe I could find out like why, then there also we were studying why elders were not coming. Of course, they identify the need, but they probably failed in providing a good environment for senior citizens to attract them. They didn't do probably they didn't do the proper spade work or research in coming out of proper countries, but it was there. But no, not much any beneficiaries, and maybe one or two. I think I would have met. I don't remember exactly now. Then the concept I could see like it was there, but it was not curated or fine-tuned well. But here coming back, like so we, after talking to senior citizens and after visiting this, we organized a meeting that was I think on Infantry Road. There was a small place. In those days, it was IAS Officers Association or some corner building, or KAS officers, some IAS officers, some association thing. Where a couple of our home care members were IAS officers. So what we thought was, we invited quite a few senior citizens for that brainstorming meeting. Senior citizens, our government officers, maybe some well-wishers, some good people like who were concerned about the problem of the elderly. We just half a day we were discussing. So at the time, Vilasini Kumar, I think you must know, she really played a very key role in organizing such a meeting. And after half a day, we were discussing about the problems of the elderly, and maybe deliberating more on the loneliness part of it and what could be the right answer to it. So we thought at the time only this concept of Elders Enrichment Center, we felt, yes, though it is a daycare center, we should not call it as a daycare center. We should call it as Elders Enrichment Center. And we thought and also at the time Malleshwaram, we had a lot of our home care members. Like, we had quite a few families in Malleshwaram availing our services, like, upper middle class, elders, quite educated people who would, sort of like this type of ideas. Because the place is very, very important whenever you start. Then how to go about it. Then that particular meeting, it was sort of eye-opener, and discussing with the elders and others there, we came out with some good programs, in the sense it cannot just like maybe engaging or maybe asking elders to come and spend time and go back, or watching them to watch TV or read newspapers, which should be more than that. So certain themes we thought about, and one is maybe the physical fitness. We thought like it should be a very important thing. So we were discussing about yoga. So I don't remember the names. We named all those things, like also social concern. Then because secular feelings, they are very important in Nightingale. So we thought like at the same time, spiritual enrichment is very important for senior citizens. So essence of different faiths. So people can come and talk about different religions, and can talk, and health aspects, and library, learning computer. So like that, we few important things we chose, and accordingly, like we structured the programs. It's a very structured program, and we managed to get a good number of volunteers also, mostly from Malleshwaram area. So our, because one is we involve the community in planning. We are involve the stakeholders in planning. It's not that Dr. Radha and myself, we just planned, no. And secondly, we visited also, like, I mean, a center, not Dr. I visited, Dr. Radha didn't come, I went to Delhi, and I visited a center and studied what went wrong there. Then thirdly, like, I mean, structured programs depending upon the needs, what elders look for. It should be assigned morning to evening, having different programs involving volunteers. Then the professional management, like, I mean, we felt the need to have a social worker as a manager to talk to senior citizens, maybe understanding the psychology, maybe those who are lonely, like, and talk to them and counseling them. And one more important thing is we also spend a lot of time and energy in setting up a good environment for senior citizens. In those days, in 99, Nightingale Medical Trust, that was the first project. We had a few trustees at the time. Even financially, like, I mean, no, we didn't have any support from anyone. But we were determined, if we want to make this type of concept successful, it should be an attractive place for senior citizens. If we just provide a place like garage, probably that may not be attractive, they may not come. So to keep all these services, we chose a beautiful place in Malleshwaram with a lot of greenery outside, and to house all these facilities. In the time, rent was about 25,000 per month. Some of our trustees even warning us, like, I mean, how are we going to, like, I mean, one is getting it renovated, getting it done. But we used to think big. I don't know whether you remember at the time, even invited Mr. S Krishna, he was a CM, to come and inaugurate it, because when we met and briefed him about the concept, we like, but unfortunately he couldn't come due to other commitments. But he sent one of his senior cabinet ministers to inaugurate. That's how Nightingales Elders Enrichment Centre, I think in December 12th, I think, or 11th, I'm not sure, in 99, because that was International Year of Older Persons. So we were very keen during this International Year of Older Persons, we should start this model center, like, to mitigate loneliness, the most important problem of senior citizens facing those days. And we this is how it started. And maybe if you ask me, maybe about the services, probably I don't remember exactly now. Morning to evening, different activities. And of course, daycare was there, in the sense, like, the elders who couldn't fend for themselves were coming there. So for them, we had a vehicle, and going and fetching them and bringing them and taking care of them. So there was a nurse also, I believe. I don't remember now exactly. And yes, we had. And various activities, activity-based center to fulfill elders' physical, emotional, and social needs. That's how, like, I mean, it was, the whole thing was structured. And we formed a coordination committee. Yes, though trustees were there, we were there to manage. And the coordination committee, that is again a beauty of members and volunteers. Volunteers really played, like, I mean, very, very important role. Like, I mean, the success of the center, Kala is a witness. Like, I mean, now, well, she's taking part, but otherwise, those days she was a very, very active volunteer. They are emotionally charged, though we have very good staff, they paid staff, but the emotional, like, I mean, feelings of volunteer, because volunteers come with a lot of energy. We'll ask him, like, I mean, how she contributed, like, I mean, for the growth of the center. Amazing. Though we were instrumental in starting, but all these things, like, I mean, fell in place. People supported us, and we could get a good place, and people gave ideas and structuring the program to be different everywhere. Like, I mean, so that we could conceive this beautiful concept and establish, and involving the members there, the committee, the coordination committee was quite active. But now things have changed. I'm talking those days, it was quite active. Everything, any program, we used to discuss, like, I mean, sincerely with members, and decide whether this is required or not required, or what are modifications to be made. That's how, like, I mean, the beginning was there, madam. I hope I covered everything, but anything more if you want to ask.
Kala, you have something to ask? Yes. Volume. No, I can't hear you.
Yes, yes. I just unmuted. Now you can hear me, I think. Raja, what you said about having this type of a center, that itself was unique. But you see, it was also unique at that time to attract volunteers. Now, volunteering is a concept that has caught on. At that time, it was not. So, how did you think about this? You didn't have any model, right? You went to Delhi, you saw this daycare center, which was practically empty. You found that you have to make a place attractive, you have to offer other activities. But then this whole idea of attracting volunteers was something quite different. And I remember that in the beginning, there were so many of us, some 15, 20 volunteers, which was very unusual for that time. So I was very curious to know how this idea came to you.
Kala, for me, NGO is not something new because I started my career working with the NGO and my studies, my master's and my MPhil, all like in the social development sector. We studied, like I'm in a college, in the universities, and later when I worked in NGO for about 8 years, we know the importance of volunteers in any social development. But if you want to really develop a sustainable maybe a program, unless you involve the local community, because we strongly believe unless you involve the local community effectively, no maybe good social development program can run successfully and sustain, and the services could be sustained. So this fundamental belief, I personally had the importance to some extent. Home care helped us to source some wanted, but more than that, here I would definitely say, person like Vilasini played, because Vilasini, again, a member of our home care, at the time, even our Lalita, I think she was, but I don't remember, but quite a few people connected, and volunteers brought others. The names now I really don't remember, but we are right, more than 10 volunteers were there. But we know the importance of volunteers and involving the local community in making this unique program a success, as well as sustainable. You involve local community, whatever may be, the project cannot come to an end. Because that is not social development. Community, because it should become community program. It's Nightingales is an instrumental in starting this, though everything, but at the same time, this is what the belief we had, and with that we worked, and people I don't know whether you were involved at the time. I don't remember now, to be honest. In 1999, you were, I think, volunteer, Nakala. When did it start? Hello?
Yeah. I think it was June 99, when we were sitting around and just talking about what to
then
do.
From the beginning, you are involved. From the beginning, you are involved. Where my memory goes, I think you're right.
Yes, I had to also look up my diaries to make sure when it was. No, I understand that, but I think you bring your NGO background into involving the community, and I understand that. Yeah. Mm-hmm. So what you had all these, you had a certain concept in mind, and you were working to a plan. Did you come up against any surprises, any challenges which you had not foreseen?
Challenges in the sense initial, because the concept was new when we started this daycare center or Elders Enrichment Center. Though it's very clear, we are not separating elders permanently from the families. There are quite a few families, they thought it will become like a old age home, because they were not happy with that. So for us, maybe to create a demand for such concept, it took some time. And but we could manage, because maybe slowly the families found the services of the center good, and it was center was making positive impact on their dear ones, the parents. So they started supporting. So because initially maybe promoting or making people understand about the concept was a challenge. Second concept problem was making this project financially viable. That took a really long time because yes, our trustees at the time, they contributed for setting it up, but they kept some sort of gave us some sort of timeline to make this program financially viable. That took a long time. In the sense, I don't remember how much we were charging per month, maybe about 100 rupees or whatever the subscription those days. That was not sufficient. Like, I mean, just imagine 25,000 rupees rent and electricity, water, driver, vehicle, manager, nurse, all those things. Like, but we are very particular about the quality. We didn't really bother, like, I mean, the thing. Then the financial sustainability, like, I mean, was a challenge. Then the other surprises, yes, this building, like, I mean, sort of, it's very good, but I think a couple of years, I don't remember, like, when we were asked to vacate the place and finding a suitable building, because nobody in Malleshwaram was willing to give a place later that I'm talking about, not initially, because the lady initially gave, but later, no, she had her own plans, and we really struggled, like, I mean, to get a suitable place. That place, then again, now the present building we are moving, but at least this present building, the owner is not asking us to leave, but otherwise, the early two buildings, like, I mean, when we were asked to move out, they're getting a place, maybe within a budget. Like, I mean, it was not easy. The next challenge was, like, I mean, though the elders were, we wanted elders from mostly from Malleshwaram to come, like, and people from nearby areas were also coming, some people, but the vehicle, the transport, they were insisting, and we felt there's a need, but it was very expensive proposition, like, I mean, sort of to provide a vehicle, driver going and picking them up, and like, that overheads goes, but obviously elders, expecting them to come on their own, it's not quite a few times possible. We don't have good public transport system, or so these things. So promoting the concept, making itself sustainable one, or getting suitable place later, like when we was to move out, this transport issues and other things. But we could fix these problems, like, I mean, with careful planning. For instance, the financial viability part, when you're thinking, we felt like, I mean, definitely only through this enrichment center model, we cannot make the center financially viable. So that's how we came out with this respite care, like that, like, I mean, sort of everything we came out. And today, yes, like, I mean, COVID affected, but otherwise, the center before that, like, it was a sustainable model.
And what did you actually think that the success of NEEC would be? What for you, from your angle, what was success of Nightingales Elders Enrichment Centre? Did it achieve it? Do you think?
See, the fact that, like, I mean, today you're talking to me, in the sense, like, I mean, how you are emotionally attached, and you have a larger family. So this is what we had in mind when we started. Like, I mean, elders should come out of loneliness, which they should have larger family, and, like, I mean, in a fun-filled way. Like, I mean, they should be happy. We wanted elders to be happy, not having a clear timetable. And the success. See, one point, like, I mean, I don't know. I mean, could be wrong. Maybe if you look at, because I'm really not going to forget the numbers. But when you look at the numbers, so far, maybe in the past, maybe the 22 years, over 450 members registered at NEEC. I think so, more than 450 members. And average 30, 40 elders have been coming earlier and availing services. And some important programs, about 50, 60 elders were also attending. Because of these activities, none of them, I don't know, maybe if one or two exceptions could be them, more that though this dementia, Alzheimer's disease is quite common among the elderly, none of our members, like, I mean, got into this type of serious, brain disorders. I don't know whether it's scientifically right or wrong, but we feel like, I mean, if it is right, when I wish, it is right. And, like, I mean, such a serious health problem that elders face now, the dementia, Alzheimer's disease, like, none of them got into the serious brain disorder. I feel that's definitely a success because the support system, the peer support there. I'm not saying Nightingales is done, but they are now like, attached to each other, attached to the center. They're not lonely. They support each other whenever there is a loss, any problem. They share the joy. Uh, we we managed to achieve that. We managed to achieve that. Bond is there, and the sense of belonging and we see when now elders there mostly. You see when you come, elders, the face, the happiness. When you come to they're all like, I know, and I remember those days when people, when they came up, they're not very happy. Like, it took some time for them to open up and talk. But they come, now members themselves, they go and talk to them and find out what is bothering them. And they easily come out, the peer support. So this is how I feel the center, sort of has become a reliable support system for the elderly. I strongly believe it's a right move that we have taken, and we have been, we have achieved whatever the goals that we set, and elders are happy. Not much of loneliness, and yes, depression could be there, all human beings, but to a greater extent, the peer support, or maybe services or the helpline, or helpline in the center, like help them to come out of it.
I asked you this because from our side, we think that we have achieved. I don't know what you feel, so I wanted to know that. We have that sense of belonging, and then because of that, as you said, many people had, never experienced what you call this dementia or other mental illness. See,
exactly.
physical, it is nobody can control it. Mental part of it, it is really a boon. And to tell you the truth, after the pandemic, some of the members are slowly slipping into it. That is very pathetic. They want to talk to people, they want to come there, but then they cannot. Nobody is really, they can't venture that coming there and then sitting with other members. They can't do it. So from our side, surely, especially the earlier members like me, we are satisfied with what NEEC has done for us. And why did you choose this name, enrichment? What sort of
That's what I told you.
enrichment?
Like, this name came out during that particular brainstorming we had before starting this. That night we had few names, and very carefully, it should be, elders should be there, Nightingale should be there, and we felt enrichment because we felt that is what elders look for. The physical enrichment, social enrichment, spiritual enrichment, and all other things. Like, finance, so that's how the whole concept was developed. And it's not that the name came out during that particular meeting.
Did any of the local people, that is not NMT people, but those who are not at all connected with NMT, the local Malleshwaram people, did any of them come to you requesting such a, to start such a center or such a place where elders can meet and all?
No, ma'am. I think we didn't have such requests.
No, because that concept was not there.
It was not there. Right?
Nobody ever thought of it.
Exactly.
And you started other centers also in Bangalore, but I should say that none of them have become NEECs of Malleshwaram. None of the other centers, they are all different. I'm proud to say that Malleshwaram Center is totally different from all the other centers. And we belong to it. And what can I say? It is our more than an extended home. So
I completely agree with you. It is a first project of NMT. And as that project has become a success, we could start a lot of other activities. I hope you must be aware, like, quite a few activities of NMT today, all were started, maybe at our center. If you take, okay, today we are talking about job 60 plus. I know it is an idea of Mr. Kalawar.
Mm.
Those days, like, sort of, whenever I used to visit, and he used to come and discuss and share this burden. And that came, of course, people were asking us, like, but that the commitment, and he wanted, then we had some brainstorming and came out. Today we are having our Sandhya Kirana, going to, the slum programs, in the sense for marginalized elders. Because the social concern, the concept came. I remember how our members were going to slums in Yeshwanthpur area, nearby places. So even we went along, we could see the problems. That's how, the point I'm telling you, the first project, no doubt, we are also, like, emotionally attached to NEC. Yes, there are a lot of other programs, or maybe size-wise, there are bigger, larger programs, like you say, Kasturi Nagar and other things. But definitely we agree with you. This is the most important program of NMT, and that was instrumental. I know quite a few members supported, like, even financially, for the growth of the trust. We cannot forget, like, but for NEC, NMT would not have grown to this extent. So for that matter, like, the members and the volunteers there, they definitely played a huge role in the growth of NMT.
Volunteers were really, they were the main part, I can say, in day-to-day programs. Not otherwise, but day-to-day programs conducting and then guiding the members. They have guided so well, but that now only members are doing it. We don't have volunteers, as to say, except Usha only comes for that Friday talk. But even then, when Usha was not well, when she went to some foreign countries, we conducted it. So everything was done by, it is now being done by members. And earlier, I remember volunteers and all of you telling us that in course of time, you will have to manage your programs.
Right.
Volunteers are only guiding now. You will have to do it by yourself. And then the idea of Women's Hour, that was really a wonderful idea. Nobody had it so far. We had it on Wednesday, and then probably you know that men were competing with that and then started a stag hour and then it stopped.
And initially, women were not at all coming. Initially, when we started, only men were coming. But now you see, like, the women's are, women, yes, they really, like, yes, more active than all other activities.
Actually, I was against it because I never worked in a women's college, or I was never a member of any women's organization. I was totally against it. But Shalini insisted on having it. She was and then Dr. Radha also thought, you also thought that many of the women are shy to mix with men, elderly women, so they're not used to it. So that was a very good idea.
True, I agree.
Hello?
Yeah, I also wanted to point out that many of the activities, you gave the overall idea that there should be, a physical fitness program. There should be something for, socialization, something to deal with emotional problems, intellectual, spiritual, and so on. But within that framework, I think there was a lot of initiative from the members themselves saying what they would like to have, what they would like to do. And many members came forward and ran programs. Mr. Tagarshe, for instance, Ramesh Tagarshe, he conducted programs. Gunud afterwards continued. Like that, whatever ideas you may have had, did you see them being sort of hijacked or being channelized in a different way, or was it all within the overall framework that you had envisaged?
No, actually, we wanted to involve elders in the program. So when maybe elders came forward and maybe managing such things, we were really happy. Like, I mean, we were, because we wanted, I mean, that to happen. We wanted to, maybe render services always. See, now, as Madam was saying, in the sense, uh, because members, like, I mean, they manage. I mean, they know how to manage, the programs better than, like, I mean, maybe some of our staff members, no doubt about it. And the volunteers can do much more. And we are happy, Kala, about it. Like, I mean, when members came forward and volunteered to do, I know Mr. Ramesh Rakesh, a la carte program, all those things. This is a wonderful idea. We never felt, we are quite happy. We'll be more than happy. We wanted more elders to be touched. That's it.
But you remember some people came in the early days of the center to see how it was functioning because they wanted to start similar centers in other places. But I don't think anything really took off on these lines. Why is it that, this enrichment center model does not seem to be easy to replicate? Is it because you are so much more open to members and volunteers organizing the programs? In other places, it becomes very structured, perhaps. Or is it that the environment that is created is not so attractive? You say that it's very important to have an attractive environment. That's not always possible to create. Is that it? Or do you have any reasons for why the enrichment model as it is there in Malleshwaram hasn't really been replicated elsewhere?
Yeah, you are right. Like, I mean, quite a few people visited our center and wanted to replicate this model. But sadly, like, I mean, to the best of my knowledge, it was not done, except a few programs targeting marginalized elders, supported by government or some philanthropic organizations. They are running, but not this level. In the sense, Malleshwaram, our benefit target group, it's entirely different. I'm talking about like Sandhya Kirana models are there. Sandhya Kirana models type of thing, that marginalized elders, people coming from low income group, and morning to evening, you provide them food. And then for food, they come over there. And those things are there in the country. But like Malleshwaram, NEEC, one is the cost factor, in the sense, like, I mean, the financial viability. When you are starting this program, getting the support of government or getting the support of any philanthropic organizations may not be possible. See, the donors or government, they come only when the target group is economically disadvantaged. When we say, like, I mean, a middle class elder, upper class elders are coming, they are not interested. So the financial viability, part of it, to create attractive ambience with various facilities, having good staff and good facilities, it's quite difficult. It's quite difficult. Elders, yes, they do have, the financial capacity to pay, but because with the retirement, there are various other reasons. Like, I mean, they feel insecure, and they have some limited resources, and they'll have a lot of other concerns. So I don't know how much we charge in Malaysia. I think it may be less than 400 rupees. I don't know how much we charge now per month.
Yes, around 4, I think.
400, no?
I too have forgotten. It's
something like less than 500.
We have
with this type of a subscription model, Kala, because that could be one of the reasons. See, but it is possible. Probably, like, I mean, sort of, we have to. I'm not saying that it's not possible. But yes, you are right. Actually, it's not come up. But we all do some brainstorming. It's possible. Probably we have to come out with some more cost-effective model, targeting the same target group and having similar activities. It is possible, I think. But see, our style of functioning is different, because this style replicating may be difficult. But maybe some other way, maybe sharing the building with somebody else, or some other, maybe sometimes schools are open after 4 o'clock in the evening, are available. So we have to find out some way where, because a place like Bangalore, cost of the premises is quite expensive. And another thing is, fulfilling the aspirations of the elderly. Like, I mean, in Malleshwaram, the sense, like, when the people come, they come with a lot of expectations. If the center doesn't fulfill the aspirations, then you can't, maybe the program cannot, run always. So the whoever wants to run, I mean, they have to, and also it varies from place to place. See, the Malleshwaram concept tomorrow, like, I mean, so we tried it, for instance, in our Kasturi Nagar. That didn't work out. Same, maybe organization, same principles, same beliefs. And Kasturi Nagar also, like, I mean, sort of the target group, all similar. But no, that didn't work. Then when we were asking them, and the answers they gave, they have seen enrichment center only as a yoga center. Only as a yoga center, or maybe sometimes outings or picnics. Otherwise, most of the elders after 11 o'clock, they were maybe they were going back home to take care of their grandchildren and other, they had other responsibilities. And nobody, like, I mean, could come in the afternoons for any programs or come for talks and other things. So Malleshwaram, maybe, our members, they're definitely different. Like, I mean, I think their aspirations are their interests. It's something unique.
So we come back to this word unique. Everything is unique about what you do, whether it was your first project, the home health services, or the next project, the enrichment center, and then whatever else you've gone on to do, which is always identifying a certain need and meeting that need with community support. So
that's right.
That seems to be the strength of the organization, really.
Exactly. That's right. That's very important. Yeah.
Do you make a survey of the area there? That is, what sort of people are living there? When you start such centers in other areas, do you make a kind of survey? What their needs are, how to start this, what they would like to have? Did you do that when you started Malleshwaram Center?
When we started Malleshwaram Center, we have done some sort of a market survey, but we have done it ourselves. But that was mostly among our home care members. I don't remember the sample size. When we were fine-tuning the concept, what exactly they were looking for, and to plan the services and activities, we have done survey. But nowadays, when I personally go and talk to different peoples and understand their need. And now we learned what will work, what won't work. Over the years, we learned. But Malleshwaram, we have done our home care, for instance, when we have started, before starting. Because Malleshwaram we chose because after the survey, because when we knew a lot of elders living there, and living alone in the sense, like, without families, sense along with spouses, and they were looking for a place to come and, like, sort of to meet others. So there was a need was very much felt in Malleshwaram. Sadashivanagar, people were not, other than we were into there also, because we had a lot of people there, but they were not showing much interest there.
So Kala?
Yes, Raja, I think this is what we basically wanted to know, how you thought of setting up a center like this, what your expectations were, and whether they were fulfilled. And Vasanta, I think we have understood how all this happened. You've given us a very, very detailed, and at the same time, many of these things we knew, but you have put it in a different kind of perspective, in a larger perspective. So thank you very much, Vasanta.